So then we've made the transition to really clearly confirming that you're sick. For some people, this might be the positive lab test that has come back. Some people who don't have access to testing or are not being tested know for sure that their signs of COVID are omnipresent. And sadly, they might not know for sure that they're positive until maybe testing opens up sometime down the road. If you did get a test, don't call for those results. The lab or primary care clinic will call you and let you know. And that's just simply because they have such a backlog of everyone calling them who has been tested. And if there's any delays, it just kind of overwhelms the lab staff so they can't get that work done. But like I kind of alluded to in the last set of slides, hunker down, keep hydrated, be extra cautious about how you're getting rid of used tissues or napkins, clear the junk out of your lungs if it comes up, keep eating, keep hydrated. Those are kind of those last two pieces are especially important. Take care of yourself as though you have a bad flu bug or a bad cold anyway, even though your symptoms might be even worse than that. But hunker down, keep hydrated, that's kind of key. At this point, you're sequestered in a room, hopefully with your own bathroom, and the rest of your family or your housemates are somewhere else in the house far away from you, and there's kind of like this boundary in this border, which is the door where food might be left off, and then you open the door after they go back downstairs and you take the food, eat it, and then put the dirty dishes out. And that person who's helping to take care of you hopefully has gloves of some sort. They could be dish gloves or gardening gloves or whatever, will take your food and put it directly in a sink that they would clean or dishwasher, so they can kind of be very carefully washed and kind of separate from any other clean dishes. Handle with care, sanitize. If the person who's helping to care for you needs to go in your room, hopefully there's a mask of some sort that they can wear to go into the room. And if you ever decide to leave the room for some reason, let's say there is only one bathroom in the house, you should have a mask or a bandana or something to try to keep your face covered as you leave the room, if that's possible. I know we've been out of masks for like a week and a half here in Denver, so just kind of make do with what you can. It's really important that you monitor your breathing closely. If you have severe shortness of breath, you need to call someone, and I alluded to that in the Am I Sick video just a bit ago. You might call primary care, you might call 911, or you might call the emergency room that's of the hospital closest next to you. But if you think you're going to be leaving the house at all, again, to go to the hospital, or if the ambulance is coming to get you, try to have a mask ready of some sort. Again, bandana, a scarf, whatever, so you kind of have your face covered when you leave the house as well. Again, if you had called your primary care provider before, when you first started showing the symptoms, they might have some clear instructions on what they want you to do before you would have to go to the hospital. So just kind of follow those directions. But for sure, when you call anyone, if symptoms are getting worse, you want to make sure that they know that you have COVID-19 symptoms so they can be prepared to accept you on their end as well. I know both ERs here on our campus are kind of, they have tents outside, or they have alternate entrances for folks who are likely COVID positive coming in. So we'd want to make sure we shuttle any sick people kind of through those. And like I said before, have a mask or some kind of mouth cover ready to go. But again, those are kind of the extremes when kind of there's a tipping point and really feeling super short of breath and having trouble breathing. For most people, they're going to kind of convalesce and get through it, and it's really, really crappy for a handful of days for a lot of people. And just know that if you're stable, you don't want to go to a hospital if you don't have to. So kind of keep that in mind, and everything should be fine for the period of X number of days until the symptoms really start abating and turning around.